We don't have accurate data in South Africa on the prevalence of drug use. The only data we have is on treatment admissions, and that isn't easily extrapolated, or it doesn't inform us very much about the prevalence of drug use in communities or the way drugs are used. However, we have anecdotal data that would suggest that there's been a sharp rise in injecting drug use in South Africa. And we know from international data that where people inject drugs and they don't have access to the relevant services and health services, there comes a particularly high burden of disease, and that would include hepatitis C and HIV. And this has been confirmed in recent studies in Tshwane, where we've seen a prevalence of 93% of hepatitis C amongst people who inject drugs, and 43% in HIV. And this is expressed in the preliminary results of one study. And in another study that colleagues of mine conducted, it would suggest that these figures are not over-exaggerated. It would seem that they're robust and that this is a problem that actually exists. And certainly that's what we're seeing on the ground through service delivery. And this is particularly worrying because if we don't do something about it now, we are going to be sitting with a tremendous burden of disease, not only on individuals, but on entire communities and on the health system. And so now's the time for pragmatism. We can't sit on our hands and pretend this problem is going to go away. We need to take action now. And we need to have interventions that reduce the harm related to drug use in a prohibitionist setting. And we've got to give people access to health services in the community. We've got to deliver health services in a manner that's acceptable to them, that they're going to take up those services. And we also need to provide the services that they want to need, in spite of the fact that they may not want to even stop using drugs. We need to take action now.